Hi there, you're back with us in the Devex World live stream content studio, where I am joined by Emily Kaine, Senior Vice President of Global Health at USP, or US Pharmacopoeia. Emily, thank you for joining us.
Thank you.
So USP is a non-governmental organization that works predominantly in the area of medicine systems regulation, both here in the US and abroad in other countries like Singapore, Nigeria, Ghana. But that phrase, medicine system regulation, what exactly does that mean, and how does that work into the work that you're doing?
Yeah, that's a great question, and let me tell you a little bit about what USP is, and I think that explains our mission and our work a bit more. So USP is almost 200 years old, and we were actually founded in the United States by a group of physicians that were really frustrated because they were trying to treat their patients, but the medicines weren't working or they were inconsistent. So these physicians actually said, well, let us develop a book whereby we can test these medicines to figure out if they are really what they say they are. And that's how the US Pharmacopoeia came about. And that was 200 years ago, so that was even before the US FDA or any strong medicines quality systems in the United States. Fast forward to today, and fortunately in the United States, we can generally take for granted that the medicines we're taking are what they say they are of high quality. This isn't the case in many lower middle income countries. In fact, a recent WHO report indicated that 10% of all medicines in LMICs are substandard or falsified. So this is a serious problem, and today we work in more than 30 countries worldwide through USAID and other donor funding. We work with regulators and manufacturers to build strong quality systems, and what that means is really the systems required to check medicines to make sure they are what they say they are, and also the systems required to really consistently produce high quality essential medicines.
So it's interesting what you said there about how here in the US and in other countries we perhaps take for granted that the medicines that we buy in the pharmacy or receive from a hospital are in fact of good quality. So in other countries, say, could it be quite commonplace for a person to walk into a hospital, receive a medication like an anti-malarial or something, and it not actually do what it's intended to do?
Absolutely. And, as you can imagine, and you pointed to the hospital scenario, what that does is it erodes trust in the health system. And of course, it also impairs ability to treat illnesses, and it increases antimicrobial resistance. So there are a host of problems associated with not being able to trust the medicine supply. And there are a lot of reasons it could happen. Medicines can be outright faked. Medicines can be great when they come out of the manufacturer's door, and then they can take a long path through a lot of different conditions, lots of heat, improper storage, and by the time they reach the patient, they're of poor quality.
So talk us through what elements make up a really strong medicines regulation system and stop patients from receiving these medicines that might just completely not work.
Right, so it is a system. And of course, you can't test every medicine on the marketplace, and every regulator faces these challenges. But fundamentally, a strong regulator needs to be able to review medicines that are coming onto their market and efficiently accept new medicines onto the market so that patients can be treated with the latest treatments. And that's all about what we call dossier review. Also, when a medicine is circulating in the marketplace, a regulator needs to be able to test those medicines, prove that those medicines are either what they say they are or not what they say they are, and then take decisive regulatory action to remove those medicines from the market and prevent manufacturers from continuing to produce these substandard or fake medicines.
So what would you say the role is of a pharmaceutical standards organization like yourself in the wider global development context?
Well, that's a great question. We are all about supply of safe, essential medicines. So, I think while it's often not considered, quality of medicine underpins almost every health outcome. So we're a bit like the Intel Inside for many health outcomes, and the other point I would make is that a regulatory system, a strong regulator, is integral to a strong health system. And as we think about countries transitioning from donor support, it's absolutely critical that they are able to have the systems, safeguards in place to consistently procure safe, high-quality, effective medicines.
And what would you say to global health practitioners that are perhaps working to fill in some of those other gaps in a health system? So perhaps people are even too far away to access a healthcare center. How might tackling this particular problems feed into the work that they're doing?
Right. Well, I think fundamentally having a strong regulatory system will engender sustainability, right? Imagine a situation where there's a stock out of a first-line TB drug because the regulator isn't able to review medicines properly and bring them onto the market, or a situation where substandard antimalarials are just flooding across the border and being used to treat patients ineffectively. Or even a situation where maternal morbidity and mortality increases because substandard medicines are being used to treat postpartum hemorrhage. So you can see the pieces to health outcomes that high quality essential medicines contribute.
And how are USP working with other countries, particularly those in a developing country context, to really tackle that issue and ensure that they are, upping their game when it comes to making sure that medicines are of that top quality?
Yeah, well, I think our main partners are certainly regulators. So we work hand in hand with regulators in country. We also work with manufacturers, and that's an important part of the equation when you think about supply of essential medicines. And we work with manufacturers to make sure that they are able to consistently supply high-quality essential medicines to the population. So working with both of those elements is really critical to sustainability.
And are you already seeing a marked improvement in those countries that you're working with regulators and manufacturers?
It is a long road, and it does take time. Yes, we are seeing substantial progress. I can point to some key successes, particularly starting with manufacturers. We've worked with manufacturers around the world to produce essential medicines that are in short supply, and we've enabled 30 of them to receive stringent regulatory or WHO pre-qualification, which is just a mark of reaching the highest standard for manufacturing. And certainly the work we do with regulators has shown immense progress. Regulators, I'll give you an example. We worked in Liberia in a post-conflict setting. There was no regulatory system. There were no laws in place. And we worked to build that system such that today, Liberia is able to detect and remove substandard medicines from their marketplace. So the regulator is really functioning to protect patients.
And are you finding that when you go and work in countries like Liberia, as you mentioned, that the governments, the regulators, the manufacturers are quite open and receptive to the idea of working with you to tackle that particular problem?
Yeah, absolutely. I mean, I think our best partners are the regulators and manufacturers, and they recognize almost more than anyone else the criticality of really operating at the highest standards.
And what kind of lessons have you picked up in 200 years? So it's a long time you've been doing this work. Are there some key things that keep cropping up as key lessons that you can share with our audience?
Oh, that's a good question, and this might sound a bit trite, but I think it's critical. Will from the top line support from the leadership in a country. That partnership is critical to success. If that's not there, there's no reason for us to be there. We've found generally governments, regulators, and manufacturers, as I've said, to be very open to receiving support. Of course, there aren't ever enough resources to support or sustain all the demand for our help.
Great. Well, thank you so much for joining us today.
All right, thank you.
And thank you for watching.